first of a 6-part series. And as we go through the series, we're going to go more and more in depth into topics. So today we're focusing on the indoor work environment and getting people accustomed to what the state expects, what resources you have, what resources our company can offer to help you out. We do have an entire page dedicated to COVID-19 education, and all of our webinars are free. We're going to be doing blog and resource updates there, and people can reach out to me directly for limited assistance with questions and answers, and I can usually shoot you in the right direction. Anything more exacting, such as the COVID surface sampling that Sumaya and I do, or actual air sampling or things like that, or any visits to a job site or a workplace, would need to be arranged separately from this educational series. So I'm going to give a little bit of just the updates of, what have we learned in this last year of the pandemic? What aspects do we have as Washington is reopening and now we're in phase 2? I'm going to talk about vaccines and contact tracing. And then the kind of bare bones of what you need to have in place for an indoor workplace. And then I'm going to go a little more in depth into ventilation, because ventilation is one of the most important things if you are going to have in-person work for preventing the spread of COVID-19. And we are going to have an entire talk on ventilation later on in the series. So I hope that I will make it understandable. You don't have to be an HVAC technician. Going to learn some basic things that you can do to improve any office space or any workspace. That'll make your people a lot safer, and it doesn't take a lot of stressful learning or too much going through everything. And then sanitation, hygiene, and the basic personal protective equipment that your people are going to wear for in-person work. And those are all topics that we're going to go a lot more in depth as the series progresses. And then just talk a little bit about some other reopening concerns. For example, if your building has sat dormant this last year, you might have mold or moisture, or you might have some issues with your water system. So we're going to talk about all of that. So we have now learned in this last year that COVID-19 is a systemic disease. So what systemic means is it affects multiple systems in your body. So we used to think it was just your lungs, but kidneys, heart, even your brain, and the lining of your blood vessels have all been shown to be impacted by having this virus. The biggest change in the last year is we figured out that it primarily is spread through airborne and droplet means. And I'm going to talk about what the difference between airborne and droplet is on the next slide. But this, an airborne aerosol, these very small particles, they can linger in the air for up to 3 hours. And a droplet is a larger saliva particle, and they typically fall to the ground within 30 minutes. Talking can produce droplets that can linger in the air for between 8 to 14 minutes. And then this I just thought was an interesting study, and we'll talk more about masks. And I even have an entire presentation just on picking the right mask or respirator for your people. But at one of the universities in New Jersey, they simulated a person coughing by hooking a mannequin up to a fog machine. And they attached different types of masks to the mannequin, and they ran a laser over it so they could measure how much leakage there was. And the fog machine simulated these fine particles produced by coughing and the velocity of the cough produced, so to speak. And the top image of this is just your homemade quilter's fabric mask. And with no mask whatsoever, the droplets from this particular experiment spread over 12 feet. With the fabric homemade mask, they were limited to 2 inches, the majority of which came out the top and settled back on the mannequin's head. So even with the desk mask in this situation before, the leakage was mainly through the nose area. And again, it settled back on the mannequin's head. So I always like to give people a rundown of what's actually going on and what makes the virus, what are its characteristics. So COVID-19 is actually the name of the disease caused by the coronavirus, SARS-CoV-2. So coronaviruses, they're an entire family of viruses, and they're given their name based around the spiky glycoprotein envelope. So it's an outer shell with spikes that gives it a look of a crown. And these spikes are what allow the virus to bind to your cells and cause infection. And the envelope is what keeps the virus's genetic material safe inside the virus. So these spikes are super important when we're talking the ability to infect, which is the viability of the virus, and the survivability of the virus. Because you'll see studies, oh, it can survive on surfaces for 7 days or 3 days or things like that. But that just means they're finding the genetic material. It doesn't necessarily mean that it can reproduce. It doesn't mean that that envelope and those spikes are intact. So we'll talk about that more on the next slide, but these spikes are fundamental when we're talking variants of the virus, when we're talking vaccine development. These spikes are the pivotal thing that allow us to fight this disease. So the coronavirus family causes diseases ranging from the common cold to severe acute respiratory syndrome, which you might remember as SARS. So genetically, this virus, SARS-CoV-2, it's 79% similar to the first SARS, which is now called SARS-CoV-1. And it's 50% similar to MERS, Middle Eastern Respiratory Syndrome. And this was a huge, huge benefit to us because more or less we had 10 years to work on a vaccine for SARS. And the vaccine, obviously, it's not going to work exactly the same because they are different viruses, but they're so similar and they're both in that family of coronaviruses, and they both have those spiked glycoprotein outer envelopes that you want to attack when you want to prevent infection. So it gave us a huge head start on developing a vaccine. Not that there's anything about the pandemic that's been a blessing, but we were given, as far as things go, we're incredibly lucky that there was already so much study into such a similar virus. So, as I said, COVID-19 is spread through aerosols and droplets. The difference is entirely size. An aerosol is less than 5 microns in diameter. A droplet is more than 5 microns in diameter. Smaller particles travel longer because they can catch on the air. So an aerosol can travel, 15, 20 feet. A droplet typically falls less than 6 feet from the person expelling it. At the beginning, they thought that fomites were the way that COVID spread, similar to influenza, norovirus, stomach viruses, things like that. So a fomite is an inanimate object that spreads diseases through contact. So a doorknob, a light switch. That's why people were sanitizing their groceries when they got home from the store. So they have found that fomites are not a significant route of transmission for COVID-19. You still do have rules and regulations related to state requirements for reopening regarding hand washing and hand sanitizer and disinfecting, and you absolutely need to follow those. But as far as the real risk of this disease, it's having people in close contact with another. So the fundamental thing to understand is how air moves in a space, how you can lower the amount of droplets and aerosols being produced by a person through masking. And that's really been the fundamental shift we've had in our understanding of this virus. And as you've seen, it is making a big difference in cutting transmission down. So the final thing I want to talk about here is survival time. So COVID-19 has a half-life of about 6 hours. What that means is if you were to cough out 100 virus particles, 50 of them would no longer be able to infect, no longer be viable after 6 hours. And then after the next 6 hours, again, half of that number would no longer be viable. So there'd be 25 viable particles. This is really important, and it's a big factor on why those fomites aren't infectious, is because you need a fairly large infectious dose of COVID-19, of SARS-CoV-2 to get sick. They think between 100 and 1,000 viral particles. And because it's got such a relatively short half-life, they think it's possible that the droplets on the surface aren't containing a large enough dose to make you sick. As far as infectiousness between the aerosols and the droplets, they're thinking droplets are probably more infectious just for the simple fact that they are larger, so they probably contain a larger amount of virus. And then the other thing with a droplet is because it's got that nice wet saliva around it, it's protecting that glycoprotein membrane, which, like I said, that is having those spikes intact are the only way that the virus can infect a host. So this slide, I've given this presentation or variations of this presentation a lot over the last 4 or 5 months. And this slide I have to update every single time I give the talk, and it's definitely very sobering. So over 500,000 people have died in the United States from COVID-19, and we've had 28.7 million cases as of yesterday in the US. Around the world, there have been 2.54 million deaths and about 114 million cases as of yesterday. I did the infographic, and that is as of yesterday, and these are the amount of COVID-19 deaths per 100,000 people in the worst affected countries. So the US, 156 people for every 100,000 have passed away from COVID-19. I'm going to talk about mortality and morbidity. So mortality rate is the odds, if you were to get infected, that you would die of the disease. And I wrote that it varies by country. It varies between 1.6 and about 10.5% of people infected with this disease will die of it. And the reason it's variable is it depends on a lot of factors. How easy is it for the person to access healthcare? What's the average age of people in that country? What are the average number of other comorbidities, things that make someone more susceptible, such as obesity or diabetes or heart disease? And then how is the overall impact of the country with COVID? You know, are their hospitals overwhelmed? Does the person have the odds of getting full treatment from getting sick and onward? So it's variable. In the US, it's been about approximately 2% of people who get COVID-19 will die of the virus. Morbidity is a different number, and we really don't know yet what that's going to be. So morbidity says basically whether the quality of life and the duration of life will be significantly shortened or altered based off of getting sick. So if you were to get COVID-19 and survive, but have severe asthma, that is a morbidity related to this. Or if you got COVID-19, but it affected blood clotting and you had a stroke and died 6 months later, even though technically you died of a stroke, that is a morbidity associated with COVID-19. So we don't know the long-term effects, and that's pretty common whenever you have any sort of a novel virus where you just haven't had the time to study the effects on the population. I think all of us know the main coronavirus symptoms at this point. In a study, 96% of patients had fever, cough, or shortness of breath, and then about 45% of them had all three of those symptoms. Loss of sense of smell is one of the most common symptoms, and they refer to it as a symptom even in asymptomatic, which means no symptom cases. Asymptomatic and pre-symptomatic, which is before people actually show symptom infections, they do spread to others who in turn can become symptomatic. So they've done studies, and asymptomatic carriers of the virus, even though they're not getting sick or they have really minimal symptoms like the loss of taste and smell, they are still making exactly as much virus and still shedding exactly as much virus through their nose and mouth as people with, you know, a cough and a fever and all of those. So I want to talk about R naught values. I feel like R naught values got a lot of play at the very beginning of this pandemic, and that is that R with the 0 next to it. And what that number indicates is how infectious, without any other controls, without distancing people, without masks, without vaccine, how infectious is this virus? So without any other interventions, it typically has an R naught value of 3. And again, this is something that can have a range based on a lot of factors. But that means for every one person who gets COVID-19 without taking those distancing, those masking, the other precautions, they're going to get 3 other people sick. And then in turn, those people will get 3 other people sick. And in just 4 generations from the original sick person, you could have 40 people infected. One of the concepts we talk about in toxicology a lot and in public health is this concept of the dose makes the poison. It refers to the fact that anything in a high enough dose can be bad for health, even water. So when we're talking a virus, dose makes the poison in terms of how long are you in close contact with somebody and how close is that contact? So the duration and the proximity to a sick individual. And for public health purposes, close contact's defined as 15 minutes or longer cumulatively within 6 feet within 24 hours. And that was a change. It used to be you needed to have 15 minutes was their understanding in any one given time. Now it's, oh, you spent 5 minutes with the sick person, and then 4 hours later, you spent 5 minutes with the sick person, and then 8 hours later, you spent 5 minutes with the sick person. You have now had contact, close contact with someone with COVID-19. I want to talk more about asymptomatic spread because we're seeing more asymptomatic spread now that younger populations are getting sick. They think there might be some correlation between less harmful infections and mask wearing, that maybe they've been getting a low dose of virus that's allowed the immune system to kind of fight it off a little better. But like I said, those asymptomatic people are still just as infectious, and there's no guarantee, should they come across somebody who's especially vulnerable, that they couldn't make them extremely ill and symptomatic. So the best estimates are between 40 and 50% of infections are asymptomatic. And then about 40% of those infections that have symptoms are mild. But mild still doesn't mean comfortable. It just means you won't need to be hospitalized. And then about 15% of the infections are severe, which means they require oxygen, and about 5% are critical, which means they require a ventilator. The little infographic is a chart from one of the very first patients last year at the beginning of the pandemic. It was a businessman who flew to Germany for a business meetings with their company, their global partner. And he was not sick at all, or did not feel sick at all while he was in Germany. And he flew back to China, and he developed symptoms fairly soon after returning to China. He developed them the week of January 22nd. And then a few days later, on January 26th, he had a positive PCR test that said he had COVID-19. Well, he attended the business meetings between January 19th and January 22nd, and they had 2 patients in Germany who attended the meetings with him, and they both developed symptoms a few days after he had flown back to China around the 25th of January. And they were confirmed positive cases via PCR. But then there were 2 other patients in Germany who hadn't attended any business meetings, but just worked in the same workplace. And they also had brief contact in the same building, and they developed symptoms and were sick and done by PCR around the 28th of January. So one person who had no symptoms at the time infected 4 other people, 2 of whom he had distant contact with. And again, this is back before we were masking, before we knew much about the virus, back when we thought it might be a fomite driven, that's surface contact driven. So we've learned a lot since then, but I think it's a really important illustration of how someone who is asymptomatic or pre-symptomatic can really drive the spread of this disease. So in Washington State, we are in phase 2. We've had a lot of different phases and roadmaps out for this. And I think our approach is really, really excellent because we are very science-driven. Washington has had 1/100th the deaths and infections of the rest of the United States. So even though I understand there's a lot of frustration, people have been really good for a very long time, what we are doing does work. And these phases, they're open for modification if we can find safe ways to do things. So I'm not going to go through each of these, but I am going to go to the Roadmap to Recovery website just so people can get familiar with what it looks like for their business. So new share. Sorry. So in addition to what's required as far as the percent occupancy, all of that, you can go, and all of these are, I include these links in the website, in the PowerPoint presentation. So right now I'm on coronavirus.wa.gov/what-you-need-to-know/safe-start. So this gives you the roadmap to recovery, and it's got a lot of resources that are really important for employers. They give you the Safe Start guidance documents. They give you links to what phase your region is on. They have frequently asked questions. And then one of the most important things that this gives you, besides the signage, is links to, if you go to the Safe Start guidance documents, which I already did, it has resources for every different type of services. So personal services, if you're a hairdresser, professional services for people like me, where I'm offering education and consulting services. If you host weddings, if you have a fitness center, and you can go to each of these links for the type of service that your workplace offers, and it will give you an outline on what you need to know. So go to professional services, because I do know we have various professional services represented in this talk right now with some of our guests. And this is going to give you an outline of what you can and can't do, what you need to have as far as your occupancy, how you need to train your people, what sort of documentation you need to have to be open, what is covered under professional services and facilities. And it's going to give you the outlines, very, very straightforward outlines to help you make sure everything you're doing is in compliance. And the state, one thing the state really asked me to press home with this whole webinar series is that labor and industry, they don't want to be cops. They want to give as many options and resources for doing the best thing to take care of your people as possible. So I just want to make sure people know what resources there are available to them to help get them started and make sure they're fully in compliance. So I'm going to switch back to our talk. WA Notify. So contract tracing, I'm sure you've all heard of at this point. Oh, it looks like I'm not screen shared. There, now I'm screen shared again. So WA Notify. It is an app or a service that's available on Android and iPhones. It's completely anonymous. There's no tracking risk. You're not giving away any personal information. Basically, you install this free service on your phone, and it sends out little random bits of code periodically, and it will bounce off other people's phones when you're in the area that also have this application. And then if you were to get sick and go to your healthcare provider, they would give you a code to type in, and that will again anonymously send alerts to those that you were in close contact with. And you can just, I check it periodically. It's very secure. It doesn't really drain your phone battery or anything like that. And it lets you know your risk. If you have had a recent exposure, you're going to want to isolate and maybe figure out, you know, are you symptomatic? Is there anyone you know who was sick? And the state will contact you for contact tracing in some cases, but it's a heavy task. So using an app like this can really help. It also helps just for public health. And I'm going to talk about a really cool study a little later on in the talk where they were able to figure out that a woman was infected from 20 feet away after 5 minutes in the same restaurant as another person. And they were able to figure that out by using a similar app system. So it's really important for figuring out how the virus spreads, protecting yourself, and making educated choices. So the COVID-19 vaccine, I submitted these slides to Labor and Industries for approval over a month ago. So I have not added the Johnson & Johnson vaccine, but It's very exciting. So we now have 3 approved vaccines for use. Pfizer and Moderna are being distributed around Washington state. Over an eighth of Washington state residents have at least their first shot. So very positive, really important if we want to keep control of these variants and get things a little more back to normal. So both Pfizer and Moderna are mRNA vaccines. And what that means is they use messenger RNA to train your body to have an immune response to those spike proteins that I told you about on the outside of the coronavirus. They don't contain any SARS-CoV-2. They don't contain any COVID-19 virus. They're newer in terms of being distributed for public use, but they are not new in terms of studies. The benefits, they're very high potency. These are up to 95% effective. 2 doses required between 3 and 6 weeks of administration. The good news is they're finding in studies that 1 dose itself can be quite effective, can have quite a good immune response. You do want to plan ahead. I'm sure at this point, everybody's heard from a friend that, you know, they felt pretty rotten after the second shot. And it just depends how robust of an immune response your body has. It's good, it's normal. This doesn't have any active virus in it. It doesn't have any inactive virus in it. But the second shot is what sort of cements your immune system. And if at all possible, you should plan to maybe take a day off the next day. My parents just got their second shot. They didn't have any major symptoms beyond a sore arm and just a little bit of fatigue for a couple days. But a good idea, if you can, is schedule it so that you can take a day off and recover while your body's going through the immune response. Like I said, the mRNA vaccines have been used in a lot of studies for influenza, Zika, rabies, various cancer vaccines, because they're very high potency, they're relatively low cost to produce, and you can make them super fast. The downside, of course, is the storage requirements that have to be kept very cold, used within a certain amount of time. So that's a benefit to the Johnson & Johnson vaccine, which is a little more traditional. It's a single shot. It's not as effective, but it's still, you know, miraculous for something that was produced that quickly and safe. And so there's a lot of options if you don't end up wanting the Pfizer or Moderna vaccines, or your healthcare provider and you decide that they're not going to work for you. So the plan is right now we're in phase B1, and the hope is we'll actually be shifting into phase B2 very soon, because we have nearly half of the eligible population of phase B1 vaccinated. The overall goal for the US is to have 100 million US residents vaccinated by April 1st, and then everyone who wishes it by July 1st. We have contracted enough different vaccine suppliers that this is a possibility. So we just need to make sure we're getting the vaccines out to the people administrating them. There's been a concerted national effort to get more vaccine to pharmacies, which will really help elderly and more at-risk populations that maybe can't get to a mass vaccination site. And you're seeing a lot of what can and can't you do after you're vaccinated. So that's where this concept of herd immunity comes in. We can't do natural herd immunity, which would be basically let everybody get sick, and then the people who survive are protected from reinfection. One, because we don't do that. We don't take a disease where at least 2% of the population would die without any sort of interference, and do any sort of herd immunity there. And then two, the natural infection resistance from this virus, they're fairly sure you're protected for about 3 months after getting sick, but they don't know how much longer than that you would be protected, especially as these variants crop up. Some of the variants are more infectious. They need a smaller dose to make people sick, or they target in slightly different ways, so your immune system's not trained by the previous infection. So we really need these vaccines to reach a level of herd immunity. The World Health Organization estimated that you need between 65 and 70% of the population to have the vaccine in order to prevent the spread. Dr. Fauci and I definitely agree that it's going to need to be a higher number than that because of the variants. And so we're looking 70 to 85% of the population. One of the biggest barriers is not actually going to be supply, it's going to be getting people to trust that they want the vaccine. Washington State has been second in vaccine eagerness. In general, the people who live here really want their vaccine. They can't wait to get their vaccine. And so about 70% of Washington State says they're going to get their vaccine as soon as they possibly can. Nationally, about 63% of people say they're going to get their vaccine as soon as they possibly can. And that is fantastic, but we need to have a greater number than that. The chart gives a little example of when you have a low immunization rate versus a high immunization rate. The red circles represent an infected person, the white represent a healthy person, and then the blue represent a vaccinated person. And in the low immunization rate in the population, you have healthy, not vaccinated individuals coming in contact with infected individuals, versus the high immunization rate, you have more of a buffer, basically. The healthy, unvaccinated individuals are protected by the people who have their vaccine, who either can't get sick or get a very low potency illness that basically prevents the virus from replicating so much. They have a lower amount of virus replication, lower amount of infectious particles that they can spread. Masks. There's a lot of questions on why would you need to wear a mask after you're vaccinated? Well, even the most phenomenally effective vaccine is 95% effective. What they do is they prevent major illness, they prevent death, they prevent the breathing problems, they prevent the long comorbidities. They're fantastic. I definitely want to emphasize that is a phenomenal number, but that still means 1 in 20 people who have their vaccine could get sick. And again, they probably would be asymptomatic. They probably are not going to have any ill effects because the vaccine is going to protect them. I just read about a 104-year-old woman who had both her vaccines, and she did end up getting sick right after her vaccine, before the full period to develop the immune response had been met. But that's still 1 in 20 people with the most infective thing who could still be spreading the virus. It also, if there's variants that the vaccine is not effective for, again, we're really lucky with the mRNA vaccines that they can be developed so quickly. So I'm certain we're going to see booster shots and things available for the variants fairly soon. But masks are just fundamental until herd immunity is achieved. And I think that number is going to need to be about 80% of the population vaccinated. So Washington phases. Like I said, we're in 1B Tier 1, which is people 65 years and older, people in multi-generational households that are over 50. It also includes the previous phase, which is healthcare workers, first responders, long-term care facility residents. and people in general healthcare settings, massage therapists, physical therapists, things like that. The next phase will be workers over 50 years old in certain public-facing settings, agriculture, food processing, grocery stores, teachers, prisons, jails, detention centers, fire department. And the whole concept of the phased schedule is to try and get a combination of those who are most likely to have a worse outcome if they get sick. As we know, this really does have very high impacts on the elderly. They're much more likely to die if they get sick. And also it's designed to focus on the groups that are most likely to get sick just through exposure, so the public-facing workers. I'm going to do another share to take you back to one of the resources. And again, all of these will be available. Sorry. All of these will be available on our website and in this presentation. This presentation is being recorded and it will be posted. And sorry, just a second. It's not showing. There we go. All right. So the vaccine information, because I'm sure a lot of your workers are interested, you can go to the Washington COVID-vaccine.org, which will take you to this Department of Health longer website, which is in the slides and on our page. And it gives you the option of the vaccine phase finder and the vaccine locator. It'll tell you what phase we're on. If any of your workers are curious about figuring out their phase, they can just go use the vaccine phase finder and figure out what phase they're eligible. That is available in other languages as well. And it just has a lot of information. As things go on, like I said, we really want to encourage people to get the vaccine and find the vaccine that works best for them with their healthcare provider or their pharmacist, and just answering the questions and countering any misinformation. Okay. Now, okay, it says my screen sharing is paused. Can people see the COVID-19 and the workplace engineering controls pyramid? Check the chat.
No, we've been seeing the vaccine phases.
Okay. Okay. Okay, it says I'm screen sharing.
It's showing now.
So now I'm going to do a new share and go back to the, okay, so can people see the vaccine phase finder now? Not gonna go through the whole spiel again, but really important site and important, especially as we get into these younger eligible groups that are in the workplace. So COVID-19 in the workplace. In health and safety, we use the hierarchy of controls, which is a pyramid of the most effective to the least effective thing you can do to control any sort of hazard or risk. Okay. Sorry, I have to alternate my. There we go. So the most effective thing you can do is elimination. And what that would be to physically remove the pathogen would be to make it so people aren't coming into contact with each other. So if you can possibly have your workers work remotely, that is the most effective thing you can do to prevent the spread of COVID-19. Obviously, not every workplace can work remotely. And so then you step into the engineering controls, which are things that physically separate the people and the pathogen. A pathogen is a disease-causing agent. So in this case, the pathogen is COVID-19 coronavirus. So an engineering control could be things like increasing the ventilation. So the virus is not able to linger in the workspace because your airflow is cycling it out through. You're using filters to cycle it out. You put up a physical barrier between workers that have to work in the same space. Then administrative controls, that's telling people what to do. That's training people and trusting them to follow the rules and do the training. And then personal protective equipment, it's considered the least effective because you rely on the people to do it and wear it correctly and all of that. I do consider masks to be an engineering control as well as personal protective equipment because they are physically filtering out the air you breathe and limiting the amount of virus that's getting into these spaces and limiting the distance the virus can travel. So that's the hierarchy of controls related to COVID-19. As I said, our later talks are going to go into each one of these in greater depth. So telework and remote work, like I said, it's fantastic if it works for your people. But there's some things you need to consider for your employees if you're doing telework. Equity, you know, are your people parents? Are they having certain needs? What can you do to make it most fair for your people? Is your access equal for the different workers? What are their equipment and technology needs? You know, do they have appropriate internet, appropriate laptops, appropriate setups? You know, should their desktop be sent home? What about ergonomics? There have been a lot of complaints of back, neck, hip, shoulder pain related to working from home as people have maybe made do in spaces that aren't traditionally set up to be an office, or you know, you have multiple people working from home in the same household and space is at a premium. And then community and connection. How are you connecting with your workers? How are you making them still feel a part of the conversation during COVID-19? So I'm not going to have time to go greatly in depth, but one of the best things you can do as far as ergonomics is go to the link on the bottom of the page on Labor and Industry's website. And it gives you office ergonomics, home office ergonomics. It gives you training resources for your people, checklists to figure out basics as far as the appropriate angles for the hip, for the shoulder, for the elbow. I really like it has various alternative types of office spaces. So how to set up a standing desk, and something that's not gone over very often is a reclining position. And they do talk about what angles you would need in a reclining position. That can be really good if you have a worker who has a bad back or things like that, to take the pressure off their spine. They have videos, free training, and Labor and Industry actually has ergonomists that are able to help for free. So if you are doing telework, which like I said, is one of the absolute best things you can do if it's possible for your work to prevent the spread of COVID-19, do make sure that you're being fair to your employees, you're giving them the resources they need to succeed, and make sure that you're addressing ergonomics so your people can be happy and productive. So masks. I think masks are pretty much the most fundamental important thing related to COVID-19 in the workplace and coming back to work, and any sort of normalcy as we get vaccines and work towards herd immunity, and very pro-mask. So the most effective mask is going to be the one you'll wear. But that said, there are different materials that do more to filter out. And as I said, I'm going to do an entire talk on masks and respirators and different types of respirators and what programs you need to have your workers in respirators. And that's the third talk in this series. So we're going to go into a lot greater detail on that. But masks are basically measured on how effective they are at filtering out particles of less than 0.3 microns. For example, a single coronavirus particle is going to be between 0.2 and 0.05 microns. And you might think, oh, well, if it's so much smaller than even what an N95 filters out, that's not that effective. But when particles are that small, you run into two different things. One, they don't travel in a straight line. When you expel them out, people sometimes think of wearing a mask and like, how could it be effective with something so small as shooting a BB gun through a soccer net? But that's not how it works. It's more like you're standing 10 feet away and throwing a bag of feathers at that soccer net. Sure, some are probably going to drift through, but the majority are going to fall to the side, hit the rope. It's just when things are that small and that light, they don't travel like a bullet in a straight line. And then the other thing is the saliva droplets that we've mentioned before, the ones that contain the greater infectious doses. Those are usually over 5 microns. That's the definition when I was talking about the difference between a droplet and an aerosol. So those are quite a bit larger than what is filtered out. So an N95 is called an N95 because it filters out 95% of those particles. But if you look at this, a quilting fabric, which is fabric of 180 thread count, or greater, and a 2-layer homemade mask can filter between 70 and 79% of those particles out of the air. So homemade mask can be quite effective. There's talk right now about double masking. In a lot of cases, it would make sense because you're doubling up on things. You do want to make sure if you are double masking that the masks you're wearing are designed for that and not going to restrict breathing too much, or you're not going to create a situation where you can't breathe out at all and the air just ends up coming straight out through the top and kind of blowing a hole and venting out that way. So the most effective mask is the one that you'll comfortably wear. Tips for wearing them for a long day. I bring a lot of them to change out through. I don't like to wear the same mask more than 2 hours in a row. I really like a 3-layer fabric, 100% cotton mask is what I prefer. So again, there was a lot of controversy at the beginning on whether masks protected the wearer, whether they protected the people around them, whether they worked at all. And we have known masks are effective for preventing disease since the 1918 flu pandemic. The West Coast actually had mask ordinances over 100 years ago to help prevent that disease. And they do protect the wearer as well as the people around it. They act as a physical shield for those large droplets. Like I said, those are greater than 5 microns in diameter. And then with those smaller droplets, or the smaller aerosols where they're lighter and floatier, they do physically come in contact with the sides of the mask rather than spreading. And as we established with one of the very first slides, is they really limit how far away from the person the droplets and aerosols are able to get, even if there is breakthrough and leakage. The study on the left was from Europe. So tea cloth is a really loose cotton fabric. So that's a homemade mask, similar to about a bandana, maybe. And then a surgical mask, and then the equivalent to an N95. And so the amount the wearer was protected was about almost 70% just from the homemade mask, as far as the number of particles that were able to come in. And then with the particles that came out, how much the people around were protected. Most of them came out with the really, really loosely woven mask, like I said, about the equivalent to a bandana. And again, with the surgical mask, because you get the leakage around the side and the face. But in all these cases, they act as a physical barrier and a filter for both inward and outward protection. During my mask talk, the third talk in this series, I'm going to go into a lot of detail on what masks you need for what work, what different professions need what. And the link to that is on the forms and publications. I'll go really quick if my screen will let me, and I'll show you what that looks like. So that is a PDF put out by the state government through Labor and Industries, and it's what mask for what task. And it goes through what to do if your people have a medical reason they can't wear a mask, or if there's any sort of hearing impairment where someone might need to see the lips of a person talking. They go into the different types of masks, whether or not you can wear a face shield instead of a mask, which you cannot, but you can wear a face shield in addition to a mask. That gives you some protection of your eyes. So it talks about when a worker doesn't need to have a mask at all if they're alone, and goes through the different risk classes and again, which masks are appropriate for which work. And so this form is available in this webinar, and it will be available on our webpage. And it's called Which Mask for Which Task. So to kind of wrap up some of the indoor work considerations, we're going to remind you again, if you can work from home, That's the best thing you can possibly do. And this was, like I said, it was approved. It was submitted to Labor and Industries back in January, and the thought was then that we would still have a phase 4. I'm not certain if that's still the plan, but more or less work from home is recommended until we reach that level of herd immunity, if you can, for your workplace. You need to make sure you're following both the Department of Health and Labor and Industry guidelines. Wherever possible, you want people to work alone in contained spaces. So that would be an office with a door, not a cubicle. And they need to be wearing a mask any other time. You don't want congregation. You don't want people getting close to each other, especially indoors and chatting. And you do want to keep social distancing even with fabric masks. If possible, consider redoing the spacing. If you have the ability, if people are sharing a space and you can't do any sort of engineering barrier, try and go longer than 6 feet. Some of my local, the hairdresser down the street, what they've done is they've hung PVC pipes and hung plastic shower curtains to help create more of a barrier system. They still really limit their occupancy, but it gives just an extra physical layer between the different hairdressers working with their clients. One of the restaurants added PVC, or not PVC, plexiglass extra dividers from where the back of the booths go to the ceiling. So each diner kind of has just their family unit at their booth space. So that can help with spread as well. So consider adding barriers and spacing more than that 6 feet, especially situations like eating in a restaurant where people are not able to wear a mask. And then after masking and isolating workers, ventilation is the most important thing to consider. So open windows, doors, doors to the outside, like I said, closed office doors is a different situation. Increase your HVAC efficiency. And I'm going to go into what that actually means. So the phase-specific COVID work plan is required for any in-person work right now. And you go to the governor's site, and where I said it has all the different lists and the links at the bottom of this page of the different workplaces, and it will give you step-by-step what's needed. So it's going to want to know, how are you going to train your people? What signs are you going to use? How are you going to keep training your people? And you do need to train people in a language that they can understand. Who's going to be the supervisor for COVID-19? Who's going to be making sure that your company does follow those rules in site for in-person work? How are you going to check the health of your workers? Are you going to have people check their temperature and do a symptom checklist before coming into the office? What are going to be the rules for hand washing, cleaning up? What personal protective equipment do you need for your work to make it safer for your workers? What is going to be your social distancing rules, and how are you going to maintain it? Are you going to add in any barriers? Are you going to change your HVAC efficiency? What are you going to do? What are you going to do if your workers get sick? And then there are special requirements for the different industries. So again, you really want to get familiar with the Labor and Industries coronavirus page and the governor's Safe Start reopening page, because that's going to really have the guidances you need to help your workforce. So this is that study that I was talking about when I was talking about the contact tracing app. So in general, they found up to 18% or 18 times increase of transmission from indoor environments because it is airborne, it's droplet borne, it's related to the proximity of people in space. It can linger in still air for a while. This study was really interesting. It was out of South Korea, and it was a situation of a restaurant, and person B was infected and was not aware of it. And the person eating directly across from person B, that's person D, got sick, which is fairly logical. But what happened is this had no windows. It just had a door. This restaurant just had a fairly strong air conditioning system running about the speed of a fan. And it sent really strong concentrated flow of air out of this overhead air conditioning system. And it just so happened that more or less a blade of air went to where person B was sitting. And that blade of air then hit the wall and curved in a straight line. So then person C, who was about 15 feet away from person B, got sick. And then person A was 20 feet away from person B and only in the space for 5 minutes at the same time as person B, and person A got sick. And they were able, using that contact tracing, to figure out it was from this encounter. And what they think is that the velocity of that fan and just the unique angles allowed much larger droplets with a greater number of virus particles to travel a lot farther than they would normally do. So I'm going to talk about ventilation and increasing it, but it doesn't just mean throwing in fans. You want to figure out, you never ever want to go from dirty to clean air. And what that means is you never want a fan or something like that blowing onto a person in a way that would bring that person's expelled, dirty air to other people. You always want to vent outside or vent to a space that's not being used, not occupied. So we're going to go into some basics on ventilation. And like I said, this doesn't have to be crazy, stressful. Ventilation, you can increase it by opening the doors to outside. You can increase it by opening windows. That's actually one of the things they're going to talk about for bringing kids safely back on buses, is they're going to space them out. They're going to open the windows and they're going to tell the kids to wear jackets. So just increasing the amount of outdoor air in a space is really important. As far as your HVAC system, they want you to increase the percent of outdoor air to the highest amount your HVAC system will allow. And that's really going to depend on the age of the HVAC system and a number of factors. If you cannot bring in much outdoor air, we're going to talk about filters on the next slide. And just increasing to a MERV 13 filter has been shown to be as effective for filtration as throwing in the outdoor air and doing greater circulation. You want to have at least 6 air exchanges per hour. An air exchange is, if you think of a room as a physical space, the air in the room as a physical set volume, how long does it take to have all the air in that space changed out with new air? So at minimum, you want to have at least 6 air exchanges per hour. To give you an idea of what that is, a basic medical room, not a surgery room, not a high-risk area, is going to have about 12 air exchanges per hour. So, the dentist office, things like that. Before and after work, flushing the space with outdoor air is recommended by ASHRAE. And then, like I said, put people in the areas with the cleanest air and have clean to less clean airflow. So if you have 2 offices side by side and one vents into the other, use the one that gets the vented air from the office as a storage space. So you can have one person in office A, and then if the air in office A vents into office B, use office B as a storage space. Don't put someone else in office B. There's a lot of different methods that have gained popularity for purifying the air related to COVID-19. Filtration's the most common, and it's the most approachable for the average person. Some people have installed, ultraviolet systems, and they do clean the air, they kill the surfaces. They might have the side effect of producing ozone, which is not good for people. So one of the most basic things you can do is just increase the efficiency of the filter of your HVAC system. And the next slide, we're going to talk about the different types of filters. If you do have a situation where you have to have multiple workers in the same space with somewhat stagnant air, you can get a portable HEPA air filter, air purifier, to help as a kind of source control. The thing to know with that is you need to change the filters and maintain them in the way the manufacturer recommends, which is usually a 3 to 6 month change out, depending on the situation. So the HVAC standards. The lower MERV ratings, and MERV is the minimum efficiency rating value. It basically tells you what percentage of particles between 1 to 3 microns are removed with each time it goes through the filter. The average MERV filter rating in a building is about an 8. And they've found that if you can increase it to a MERV 13, that captures between 50 and 85% of particles in the size that we're most concerned about, that 0.3 to 1 microns. So that's going to get your droplets, a lot of your aerosols, and that usually air systems can be modified for without having major impacts. So the most important website you can go to for your people is ASHRAE's website. They have set all of the standards as far as the COVID air quality and resources. They have a lot of different breakdown that can be very approachable for different workplaces. But like I said, ventilation doesn't have to be stressful. We're going to do an entire talk on it, and hopefully you'll join us for that. But it can be as simple as opening windows and doors and bringing in fresh air. As far as Ppe Hygiene and Sanitation, we did discuss that cleaning of surfaces is required, and the frequency needs to be determined based on use, based on shared spaces, and that's part of your COVID-19 safety plan that you have is reopening. And there's a lot more resources on some of the links that I've shown you. And then again, all of these, we're going to go into a lot greater depth on different talks, and we can talk about it more in question and answers. But if you have people working within 6 feet of each other, you're going to need to reference that right mask for the task PDF, because you might need to have your people in respirators, or you might need to do that first elimination step of those controls and figure out a way to have people work in shifts so they're not coming into contact with each other. You either have to eliminate the hazard or give them better PPE. If you do have your people in an N95 or higher rated respirator, they need to have a respiratory protection plan. So that's a plan your company makes that says why you're using respirators, how you're going to train people on them, how you picked the respirators. It has the fit testing, which is a process that lets you know that the respirator is actually protecting to the degree it's rated for based on the person's face. And then medical clearance, because breathing through a respirator, it is a filter and it is hard on the lungs. So you do need to have medical clearance, even if it's a voluntary use situation. So like I said, third webinar goes into all of these details. I'll teach you how to build a respiratory protection plan if it's something you need for your workers. In general, wash hands frequently, even though hands aren't really known to be a driver of coronavirus spread. They definitely are for influenza. They are for a lot of nasty stomach bugs. In general, you want to have good hand hygiene no matter what. Change masks frequently, like I said. Don't let your mask get wet. If you're handling a lot of different surfaces, gloves can be helpful. They're required for certain industries, construction, certain industries where people are handling a lot of different products and working closely with others. Shared spaces, again, they need to be cleaned and sanitized between use and then as often as needed. One of the most important things, there's been a lot of increases of accidental poisoning since the COVID-19 pandemic, and you need to make sure you're not mixing chemicals. So I've had a lot of incidences of people mixing bleach with things that it should not be mixed with. Bleach is a very powerful chemical on its own. I don't personally like for people to use bleach, even though it's very effective. It'll kill most any bacteria or virus that it's presented with. But I prefer unscented alcohol or hydrogen peroxide based products because you also don't want to make people sick from the cleaning chemical you're using to prevent COVID-19 infection. There's a lot of chemicals that can cause asthma if people are using them a lot. So make sure the chemical that you're using is not harmful or the least harmful possible chemical for your workers. The EPA List N has all of the approved products for COVID-19 cleaning. You can sort through that based off of main ingredient, the amount of time it needs to sit on a surface to disinfect. But since we have figured out that surfaces are not driving the transmission of this disease, just make sure you're using the least harmful thing that is effective, which again, I think alcohol and hydrogen peroxide are some of the nicer products as far as your lungs and your health. Other reopening concerns. So if you haven't had a fully occupied building or a completely unoccupied building, there's a lot of potential development of different bacteria and viruses, fungus, and also buildup of hazardous chemicals and metal in systems. So lead and copper can build up in water systems very quickly. Mold can show up within 3 days of any sort of a leak or moisture infiltration, even just high humidity. Legionella is a bacteria that grows in biofilms, which are kind of a film of kind of like a plaque. And they're very hardy. They need very high water or high chlorine to be destroyed. And they're able, if water systems are stagnant, they're able to multiply. And then once water systems are being used again, it can be dislodged. And Legionella, you wouldn't get it from drinking the water, but showering, anything that allows you to breathe in the hot water vapor could expose you to Legionella. And it's another disease that especially impacts people with weakened immune systems or the elderly. You can have general indoor air quality concerns, even just odor, if you're turning on heat for the first time in a long time. So a lot of what we do to save money and shut down a building isn't necessarily good for the water and the air systems. It can take several weeks to prepare a water system for reoccupancy. And the CDC has a guideline for these 4 major concerns, and the link below. I'm going to be giving a talk on I believe Thursday, the 25th of March, not through this series, but through my parent company, Sound Earth Strategies. And we are more than willing to send out the links to that. And we'll have various links to that. But those are all things to consider, as well as your COVID-19 reopening plan. And then before we wrap up this talk and go into the question and answers, talking about COVID-19 and mental health. And this obviously isn't just something that impacts the indoor workplaces, but I feel like it's worth bringing up when we talk about taking care of your workers and their health and safety. We're a year into a pandemic. Life has fundamentally changed for people, and everyone has different reactions. Burnout's really normal because people have been at a really high level of stress. It's also normal for people to be nervous about going back to in-person work, and communicating and training your people, showing the aspects and the steps you're going to take to create a safe work environment can really help with that. There is a specific COVID-19 free resource called Washington Listens, and the phone number is available there. I encourage every workplace to make sure that they're talking to their workers and hopefully giving them strategies to move forward and feel safe and taken care of in their workplace. So these are just some of the resources that I showed during this talk. L&I has an entire small business unit that has consultants and resources. They don't have separate COVID-19 information for small businesses. You're going to want to do that Safe Start page and the governor's resources that I showed you too. But the small business is really going to advocate for you if you need help there. As I said, we have this series. I'm going to be doing blog updates, links to articles that are relevant. And I'm also going to be available if there's topics people really want addressed. They can email me and I'll make sure that they're included in future conversations. And I think I'm going to take a real quick look at the chat and see what questions were asked. And then we can go ahead and start taking other questions, and people can go ahead and unmute. Thank you so much for coming here. All right, one of the first questions I got is people on the internet are expressing concerns that the vaccine will alter their DNA. Can I clarify how the vaccines work? There are 3 different types of vaccines currently in development or in use for COVID-19. The mRNA vaccines, they basically synthesize, they use messenger RNA to synthesize just a small fragment similar to that spike protein, and your body is able to develop a really targeted immune response to all those spike proteins. And that prevents, if you get actual exposure to COVID-19, that would prevent the virus from being able to replicate in your cells, because those spikes are not able to bind to your cells and prevents infection. I am not an immunologist, so I do believe that the Johnson & Johnson vaccine is an adenoviral vaccine, which is a little more traditional. It still would not contain any dead or live COVID-19 virus. And I believe I will have to look into that a bit more, and I can address it more for subsequent lectures. But they're very safe. They've been trialed. This is one of the biggest feats of ingenuity and science, communication and partnership. The whole world has worked together to develop these vaccines. What is the difference between an N95 and a KN95 mask? So one is the country that they're tested in. KN95 masks are certified in China. N95 masks are certified in the United States. Both are designed to filter out 95% of particles less than 0.3 microns. There's debate whether the KN95s reach that level or not. There have been independent tests and things like that. But the Chinese masks, they actually are fitted to live people as part of their certification process. The N95 masks are certified under the same standards, and they have higher level of certification for a thing called pressure drop. And pressure drop is the ease of breathing in and breathing out through the mask. So N95s are a little bit easier to breathe in and out of than a KN95, but they both should have the same level of protection. If you have work that requires an N95, certain certain construction, if it's work that required an N95, a KN95 is not a good substitute. If you have work where you'd like an additional layer of protection, but you're not in a high-risk COVID situation, a KN95 is a great method. You can add in a face shield to give additional splash droplet protection. And I don't know if I clarified, as far as respiratory protection, face shields do not add anything in terms of respiratory protection. They are there to keep droplets from accessing your eyes, and they can be a great thing if you are required to wear goggles or glasses as part of your work because you do have some level of patient risk. A face shield can be an additional barrier, or if you're having a lot of issues with fogging, it can add protection but limit the fogging. All right, what other questions do people have? And again, people are welcome to unmute if anybody wants to have any discussion before we wrap this up or anything like that. We're a small enough group. All right, well, thank you so much for coming in. I'm really looking forward to the rest of the series and going a little further in depth to all of these topics. My email is on the last page of the slide. I'm also available through our webpage. So if you think of any specific questions for your industry, please reach out. The next talk we're going to be giving in this series will be on the outdoor workplace, so construction, landscaping, agriculture, and that is going to be on the 23rd, so 3 weeks from today of March, and we'll have links available for that. And then after that, we'll be getting more into the specifics on engineering and ventilation and the right mask and all of that. So please share, and if there's anybody you know this would be useful to, please let them know. Our This was recorded and it will be uploaded to our YouTube channel and our company COVID-19 education site within a couple days as well. So please feel free to share that link. Thank you so much.